Hi, Lindsay. My name is Josh. I'm a nurse practitioner student from Saginaw Valley State University. How are you today?
I'm doing good.
Okay, today I'll be performing an abdominal assessment on you. Do you have any abdominal pain currently or ever had any abdominal surgeries?
No.
Any of your bowel movements been normal?
Mm-hmm.
Any issues urinating?
No.
Okay. Then what I'm going to have you do right now, wash my hands, noted your vital signs. Your vital signs are all within fine ranges. I'll have you lay onto your back here and we'll begin the inspection portion.
Okay.
So what I'll do, looking at visualizing with his abdomen, I'm going to look and see if it's symmetric, if there's any bulging. I'm going to see if it's flat, if it's distended, or if it's scaphoid, which would be kind of concave in nature. Lindy's appears to be flat in nature. As I'm doing that, I'm going to see if there's any stripe, if there's any lacerations, if there's any scarring, if there's anything abnormal that should necessarily be there. And she does not appear to have any scarring, striations, rashes, anything like that. And then I'm going to visualize her umbilicus. It's not inflamed, it's not reddened, it's not swollen. And then just kind of staring at her abdomen, I'm going to see if I can see any aortic pulsations. She is a thinner individual, so she would be somewhat easier to see these pulsations on, which I can see a faint one, I believe, just below the xiphoid. And then I'll visualize as well to see if there's any peristalsis occurring within the abdomen. So then from that point, we're going to go on to the auscultation portion. So what I'm going to do is I'm going to utilize the diaphragm of the stethoscope, and I'm going to listen in all four quadrants. I'm going to listen in a clockwise fashion, pausing in between each quadrant. And then I'm going to be listening in each quadrant at approximately the mid-clavicular line as well. Lindsay's bowel sounds are active. For the time purpose of this video, I would listen to each quadrant for at least a minute, but I can tell her bowel sounds are active from the time that I was listening. And then what I'm going to do is I'm going to rotate to the bell of the stethoscope. I'm going to listen to our abdominal arteries, our aorta, which is going to be about halfway in between the bottom of the xiphoid process and the umbilicus. And then the renal arteries, which are going to be about an inch off to the side of where I'd be listening for the aorta. Then our iliac arteries, which are going to be approximately 2 inches down and away from the umbilicus, and then the femoral arteries, which are going to be directly below, a couple inches below the iliac artery. And I'm not hearing any bruits, which would indicate turbulent blood flow through the femoral arteries, bruits. Then what I can also do is listen over the spleen and the liver to see if there is a venous hum, which could be indicative of hepatomegaly or splenomegaly. And auscultating a venous hum. So now I'm going to proceed towards the percussion portion. I'm going to use my middle finger on my left hand. I'm going to be tapping essentially over the distal interphalangeal joint. I'm also using the middle finger on my right hand. It's going to be just a brisk tap. Solid organs such as the liver should have a dull sound. Over the bladder, stomach should be more of a tympanic sound. And the spleen should be tympanic as well. Okay. And then so percuss 9 quadrants. Then going from percussion, we're going to proceed to the palpation portion. We start with light palpation, working across your abdomen in a horizontal plane, and then I'll progress to deeper palpation from that point. Cold. And then at any point, Lindsay, while I'm doing this, if there's any pain, let me know, okay?
Okay.
Any pain?
No.
Okay, now I'm going to palpate a little deeper, 2 to 3 inches. And then while I'm doing this, I'm going to be noting if there's any abnormal nodules, if there's any masses, which I am not noting. So now I'm going to go back, I'm going to percuss the span of liver dullness. So I'll start below kind of the breast area on the right side, and then press till I hear kind of a dull sound. Okay. Now I'm going to start from about the umbilicus area and then work my way up until I hear a dull area as well. Okay, now I have my area approximately here. Normal would be 6 to 12 centimeters. Anything larger than that could indicate hepatomegaly. So now, what I'm going to do is I'm going to palpate for Lindsay's liver border. I'm going to kind of have her bend at the knees and then just leave her arms at her sides. And now her spleen as well. Thank you for that. I'm going to slide my left hand under Lindsay, kind of at the 11-12 intercostal space on the right. I'm going to press up towards the ceiling just to help with palpation of the liver border. Okay. Now I'm going to slide to the left, 11-12 intercostal space on the left as well, for the spleen. And kind of laterally on each side, then palpate our kidneys. While Lindsay's in this area, I'm going to also kind of see if I can gauge the width of her aorta. About that wide for the aorta is what I'm getting. And then I'll do a couple of the special tests while she's laying flat before I have her sit up and test for CDA tenderness. Okay, so first one is going to be Robson's sign, which could help to indicate if there's an appendicitis. I'm gonna palpate in the left lower quadrant, and then upon release, if you had appendicitis, potentially there would be pain that refers to the right lower quadrant. Anything with that? Okay. And then I'm going to palpate on the right lower quadrant as well, doing the same thing essentially, just to see if there's any rebound tenderness that could indicate peritonitis. So now I'm going to test for a Murphy's sign, which could indicate cholecystitis. So I'm going to palpate the liver here, and then I'm going to heavy cough Lindsay. Take a deep breath. Okay. And her cough, deep breath was not interrupted by my palpating the liver, so That would be a negative sign that we are getting. So now we're going to do obturator sign, which would be taking Lindsay's leg, I'm going to kind of flex it at the knee, and she's going to give some resistance. And then I'm going to kind of rotate internally. Are you having any pain in your right lower quadrant?
Mm-hmm.
Okay, so that'd be a negative obturator sign, which is something that we could also do to test for appendicitis. Now I'm going to do psoas sign. It's kind of going to be a passive flexion. I'm going to rotate internally and have you cough. Any pain?
No.
Okay, and then Lindsay did not have any pain with that as well. So I'm going to do a test now to test if there's any abdominal ascites, which I'm going to put a hand on each side, lateral side of her abdomen flank area essentially, and I'm going to tap one side, and then I'm going to see if I can palpate kind of like a ripple effect that comes over, which would indicate fluid shift. Okay, and then I am not sensing that when I perform that test. I'll have you sit up, Lindsay.
Turn this way.
Okay, now I'm going to test for costovertebral angle tenderness, CVA tenderness. Any pain?
No.
Okay. Then that will conclude our abdominal assessment. Do you have any questions, Lindsay?
No, I do not.
All right, thank you.